Okay. All right. Good morning, everybody. Welcome to our annual Regional Prevention Legislative Forum. We're very happy to have you all here today. My name is Margaret Watt. I'm the Prevention Director at Positive Directions, the Center for Prevention and Counseling, here in Westport, working with a number of communities in the Mid-Fairfield region. As you can see on the screen today, we've organized this forum in partnership with Easton Monroe, New Canaan, Norwalk, Trumbull, Weston, Westport, and Wilton, and open it up to our surrounding communities. I know Fairfield and Stratford are here in the room. And our purpose today is for our elected officials, whether at the state or local level, to hear from folks from all different sectors about what we're seeing related to youth mental health, substances, and gambling. We're going to share data, we're going to share stories, we're going to share policy and budget recommendations, and we'll be asking you all throughout, we'll introduce a topic and we'll ask you how you can help us with it, and we'll give you an opportunity, the elected officials, to ask us questions so we can give you the ammunition you may need to make things better for our kids. So the goal here is that we're all in this together. We all share a common goal of supporting our youth. And the answers are in the room. We have people here. We have law enforcement, we have school people, healthcare, youth services, parents, and more. I would say really the only sector that's not represented today because of the timing is our actual kids, who we do work with, but they are in school right now, we hope. So I want to first of all, give a shout out to everyone who's here. Our planning team most of the planning team are speaking today officially, so you can see their names on the agenda here. And I also want to shout out the towns that are participating. I'm going to actually list the people that have registered, those representatives and the elected officials, rather than go around and do introductions with a pretty huge room here. So, reminder to everyone, introduce yourself, rename yourself on screen so we can see who else here. I know we had the following legislators register: Senator Marr, Representatives Constantine, Dathan, Hughes, Johnson, Leeper, Mara, Perillo, McCarthy, Vahey, O'Day, and Steinberg. We have the first select women Select Women Boucher from Wilton and Carlson from Buchanan. Our new first selectman from Westport, that's Kevin Christie, and the brand new mayor of Stratford, David Chess. If I'm missing anyone, introduce yourself in the chat, but we're glad you're here. So, how's this going to work today? As you can see, we've got 5 major topics that we're going to cover. For each one, you can see who the speakers are. They'll introduce themselves. Our goal is to spend about 15 minutes on each topic, which gives us some extra time at the end for broad Q&A. For each topic, we'll have the designated speakers present a couple of statistics, facts you should know, anecdotes here or there from people, from parents, for example. And then we will post a slide with some policy considerations or budgetary that we'd like you to consider. And we'll open it up then to our elected officials where you can tell us what you're willing to work on, how you can help us push these things through, or what you need to know from us. So at this point, I'm going to turn it over to Melissa Perez-Constantine from the Hub to introduce herself and tell you a little bit about who we all are here as preventionists.
So, good morning, everybody. My name is Melissa Perez-Constantine. I am a program coordinator with Catalyst CT, the Hub. We are the regional behavioral health action organization for Southwestern Connecticut. So today you'll be hearing from speakers from our local towns, brought together through their connections to the work of the local prevention councils, or our LPCs. So in the US, prevention is based on a coalition model. Local prevention councils are community-based coalitions representing a minimum of 12 required sectors shown on the graphic on your screen, who work together to identify local problems and develop local solutions. In Connecticut, the local prevention councils receive limited funding and support from our state agency, the Department of Mental Health and Addiction Services, funneled through the regional behavioral health action organizations. For Region 1, that's Catalyst CT, the Hub. So The local prevention councils involve gathering data such as youth surveys, providing education to youth, parents, schools, and decision makers, preventing access to substances, and improving access to positive supports and services, and improving policies and laws at a local level. One thing you should know is how much the local prevention council's roles has expanded in relation to the needs that we're seeing in our communities. In Connecticut, local prevention councils were originally tasked with only addressing underage substance misuse. But now they tackle problem gambling awareness, suicide prevention, mental health promotion, working alongside and often in collaboration with treatment and recovery providers, but providing a very different service, right? However, local prevention councils continue to be funded for very targeted substance work. Our local prevention councils are eligible to receive between about 3,000 to 10,000 per year from DEMIS via the RBHAOs. And it really is dependent on their population size to work alongside a single substance plus another funding stream that includes opioid awareness. There is some prevention, suicide prevention funding at an RBHAO level, but every community varies. LPCs have to act with the trends that they're seeing at a local level, and that's an ever evolving landscape. So hopefully today you'll hear some of the issues that we're going to be talking about and hopefully adequately funding them, because really the local prevention councils are the entities that bring prevention at a local level. Thank you, Margaret.
Thanks, Melissa. And I also want to give a shout out. I realize Rep. Kadeem Roberts from Norwalk and new Mayor Barbara Smith from Norwalk have also joined us, so welcome. So here's just a slide of some recent headlines that you may have all seen that are related to just some of the prevention challenges Melissa was alluding to. These are some of the things we want to talk to you about today. Okay, we will be talking about the mental health crisis, the expanded issues related to cannabis, the black market, products like 7-OH, which is a kratom derivative that's basically an opioid, nicotine in new formats or different formats being sort of pushed at our youth. These are all some of the challenges. And then, of course, there's the enforcement represented by the photo at the bottom left of one of the many busts made in Norwalk at smoke shops that on a repeated basis are sometimes bad actors. And so, as Melissa already alluded to, our jobs as preventionists are to bring everyone together, do the education, do the awareness, do the data gathering, bring the people together. Everything you hear and see today was organized through LPCs, but with essentially no funding, as you saw in that slide. So just at the start of this meeting, we just want to highlight that as we go through, if you're thinking, that's a great idea, but who would fund it? How could we fund it? We want to just share to you some of the funding sources related to substances that you can take into consideration. So the top three of these rows are state level funds, the opioid settlement funds, the cannabis tax revenue, and of course the budget surplus. And this is where I wanted you to see what's allocated to prevention. So out of the opioid settlement fund, and this is data from the OSAC website as of this week, 7 million rounding up has been allocated to prevention with these three specific uses that are listed in the right-hand column: mailing deterra bags to homes every year, the Live Loud website, and giving out lock boxes. There are also a couple of other allocations of Narcan that are categorized as prevention and harm reduction, but it's not specifically money to the community coalitions, right? The cannabis tax revenue is worth talking about for a second here, because when we passed the RERACA law as a state, the cannabis taxes were intended to go 25% to a fund called Prevention and Recovery Services Fund and 75% to the Social Equity Fund. Since that time, some of the money from the Social Equity Fund has been diverted and now goes to the general fund. Um, what you can see here is for the last couple of years, we're getting about $40 million in tax revenue per year from the cannabis tax fund. Of a portion of that, 22 million is the excise tax, and 25% of that goes to prevention and recovery services, which is, 5.5 million a year. And that money is allocated across four different systems, right? Prevention, treatment, recovery, and data collection. And it goes to the state and region, and so far 570,000 to our local communities. So we think that this is a place where potentially the money could be distributed differently in different allocations. And also, unlike the opioid settlement fund, where there is a dashboard and you can see how funding is being used, we don't have that yet for cannabis. So there's not the transparency, and that's something we would like you to think about. I would be remiss if I didn't mention the budget surplus. I think a lot of us here would strongly ask our state reps to consider raising the fiscal guardrails, because for 8 years in a row, having a huge surplus and really having it go to the rainy day fund and the pension debt, which are important, 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 but really not right sizing the super underfunded social services sector is causing a lot of pain on the ground, and it's going to get worse. And then finally, for our local elected officials, like our mayors and select people, local opioid funding, we have the municipal cannabis sales tax in towns like Norwalk, Stratford, like the cities where sales are happening, as well as an allocation from the state. We also have the nickel per nip sales tax, which brings in a lot of money to some of our communities. Like Norwalk gets 42,000 every 6 months. And what you can see on this screen is how those monies are allocated. And, please consider what else could be done with those funds. We're not going to talk more about funding right now because as we go through recommendations, you may want to talk to us about how you could see funding some of these things. But I'm now going to move on to our first, well, I guess I should say, no, let me open it up to any legislators who want to make a quick comment on funding. And speak out because since I'm sharing my screen, I won't see you raise your hand easily. Okay, we'll hold on that.
Oh,
Oh, go ahead.
sorry,
Oh,
Margaret.
hi, Rep. Jason. Hey.
Hi, sorry, I'm just off camera for a minute while I get some stuff organized here. Thank you so much for highlighting this. Hopefully, we get a copy of the deck because I'd like to make sure I'm fully clear on how the funding works. Because when we passed the original cannabis legislation, I was very conscious that we needed to make sure that we had the adequate amounts for prevention and that those prevention dollars were going to the boots on the ground. So I'm disappointed to hear it's not. I've talked to Demas for a while about these funds. So having this data will really help and make sure that we move this forward. I know that there is a lot of folks out there that want to kind of lift the guardrails, and I do think that there is an opportunity for us to adjust. I think it's going to be hard for us to abolish or lift them totally, but I do think that there is an opportunity, particularly to fund our nonprofits that are in such need right now with the level and the crises going on with mental health and other issues. So thank you so much, and just wanted to add that in.
Thanks, Rep. Dathan. And yeah, you will all get, everybody who's signed up, if you registered and we have your email, you will all get this slide deck. And also we have a supplemental handout with lots and lots of links to current articles, data, et cetera, and also the contact information for all the speakers. Rep. O'Day.
Yes, thank you so much. Sorry, but until we're get the fiscal debt in order, I'm a hard no on lifting the fiscal guardrails. Just to be clear, as you know, Ingrid Gillespie in 2011, about the idea of getting Narcan in the hands of first responders. That was the first bill I worked on. I'm 100% in your corner, but not on lifting the fiscal guardrails until we got the highest debt per capita in the country. But I think there's other ways we can find the funding other than lifting fiscal guardrails. But I look forward to listening to everybody and learning more. And passing legislation to help save our kids. Thank you.
Thank you for that comment. And yeah, when you look at the deck, because I see that you're driving, there are other options in addition to physical guardrails. So we're going to turn to mental health now. And as our first topic, everyone's fully aware that there's been a youth mental health crisis for a very long time. While some of our indicators in our youth surveys do look better, the crisis is far from over. One of the things that we will highlight in the final segment of today's forum is the impact of cannabis use on youth mental health. But the bottom line is the services are still not adequate to meet need. There's also under awareness of the services. And in particular, we need expanded access to crisis services. The data I've got on the screen here for you, just to walk you through if you're not looking at it, we've got a bar graph, a line graph from 211 showing that in the last calendar year, the crisis intervention and suicide requests from Connecticut for 211 services were higher than the prior year, so higher than calendar 24. Just to highlight a little data from our wonderful Kids in Crisis program, we've got Kids in Crisis on the call here today. The Teen Talk program, which they have, where they have an embedded clinician in 14 local schools, in all of fiscal 25, they saw 1,070 students at those 14 schools. And this year so far, which is it's not quite the end of first semester, they've already seen 746. In addition to which they've done 59 crisis assessments this fall. So this is pointing to need, right? Statewide calls, services in the schools. This is in a region where we are lucky to have Kids in Crisis, where we're lucky to have Teen Talk, where we're lucky to have Silver Hill Hospital with the urgent with their urgent assessment program. And Dr. Gerber from Silver Hill is on the call today too, and we'll speak later. So we have these resources. What we don't have is an urgent crisis center, such as the ones that the legislature set up a couple years ago. You're going to hear a little bit about access to that. But I think the bottom line is, even if we had an urgent crisis center in Region 1, which we need, even if we had an expansion of Silver Hill services and the Kids in Crisis services, there is unmet need. And so this is really something that needs to be addressed. I'm not going to read for you the Norwalk data that you see on the screen, but I'm going to instead turn it over to Marcia Elburn, a local parent who's going to just explain why this matters. What's it like as a parent, Marcia?
Thanks, Margaret. Good morning. Hopefully everyone can hear me okay. I'm on my phone.
Yeah.
Yeah, I'll be as brief as I can. Obviously, we can all talk for a long, long time about this stuff. So I have a now 15-year-old. We've been navigating a mental health crisis for about just under 3 years now. And it's been difficult. There's really no other word. It's been really, really tough. Specifically when it comes to just access, when we've had those spikes, right? Those 211 calls and the times we've had to go to the ER, which I believe we've had 9 ER visits, not including one that was planned and we had to go all the way to Hartford. It was a separate thing, but there were 9 separate times where I had to get her to very quickly some help. And I just really I made a tough choice to go all the way up to New Haven, to Yale, which is really hard when your kid is actively suicidal, has a plan, when there are words being thrown around like psychosis and things like that. It's really scary. The last thing you want to do is be in a car for half an hour, right? With a child who sometimes is reaching for the door handle and the school folks tell you to put her in the back and put the child lock on. Like it's a really, really scary thing. For her, I'm sure there's additional trauma. A couple of those times, sometimes we're trying to stay closer. We went to Bridgeport once and I was grateful for the ability to be closer, but that was scary in its own way because I say we because I'm not leaving her side in those ER visits. But we're sort of in this place with adults and that's really hard for a 13, 14, 15-year-old to see and to experience. I think the other piece is time and wait. As you all know, you're waiting to see social workers, you're waiting for a bed, and
Marcia, you muted yourself.
oh, that's so strange. Sorry about that. Um, what I was saying was the time, right? The sooner you can get somewhere, your child somewhere, the sooner you can see a social worker, the sooner maybe you can get to a bed. So it just adds extra time to a process, I guess, or a time, a situation that you don't want to add time to. So it's hard, and I hope that we can do this for kids other than mine who are coming up and who are in crisis, who can, if they live here in Norwalk, they can get very, very quickly the help that they need instead of, yeah, having a parent who was lucky enough, right, to have a vehicle, to have time off work, to be able. There's so many things we could talk about here. So, yeah, it's absolutely traumatic and really, really, really difficult. Thank you.
Thank you, Marcia. I think you painted a good picture, especially mentioning like the transportation and time off work and all that. So, I think everyone here knows we have these resources like the urgent crisis centers, but not in our part of the state. I'm going to let Dr. Robin Greninger, who's a social worker with Norwalk Public Schools, just give an example of what happened, I think, last year when trying to access the urgent crisis centers for a Norwalk student.
Yeah, good morning, and thank you so much for having me here today. Marcia, you touched on some of the points that I wanted to bring to light as well, as how this can have an impact on our families as well as the students that need the services. Access to mental health services in Norwalk can be difficult, especially for mental health in regards to psychiatric care. So we had a family who was in dire need. We tried to get them to go up to Waterbury because they didn't have a wait at the moment. Unfortunately, the parent could not transport the child to Waterbury. They did not have their own transportation. So what I will say about these centers is they're absolutely phenomenal. If you call and you ask them for support or for help or for ideas, they're always willing to troubleshoot with you. And so Waterbury contacted New Haven for me. And New Haven was going to be ready for us, but we had no way to transport them there. So we were told, usually you can use AMR to transport students that are in crisis and need support. So we contacted the family. We let them know. The family contacted the Norwalk ambulance first. Usually that's the first call. And then you let them know you're refusing them. You would like AMR. Well, AMR was so busy at the time that they said, we'll at least transport you to Norwalk Hospital, but we can't get AMR to take you to Yale right now. So when they went to Norwalk Hospital, they said AMR will transport you when you get to the hospital. Well, of course, when they went to the Norwalk Hospital, they did not get a transport via AMR and were seen there. We do not have psychiatric services for youth here in Norwalk. So when they go to Norwalk Hospital, they're really more being seen in the ER section or for psychiatric services on a short term. They're not really getting a full evaluation for a risk assessment. And for us to safety plan for students to come back in, to make sure that they're safe in their school setting and at home, it's necessary and it's key. In fact, we won't let students back in without it. So it's been very difficult for us to be able to find that. Additionally, our families here in Norwalk and other cities in this location do not always have transportation to get a child there. And then financially, they don't always have the means to get a child there. So if we're talking about a kid in crisis, we're talking about someone who's suicidal with an active plan, it's asking a lot for a parent to put a kid in a car for over 30 minutes to 40 minutes, depending on traffic, over an hour at certain times, when they could have a plan. Like Marcia said, they can jump up and open up the door. There are safety concerns just in the transport there. In addition to that, if a student is seen at Yale and they decide to admit at Yale Hospital, that's a long commute for a parent to have to go back and forth to visit their child. And it's really not effective for making sure that there's a family component and that the student is able to access the services and has the same opportunities. Thank you very much. I really hope that we can get a service down in Norwalk. I've been advocating for this for years. Our families in this whole Lower Fairfield County need it, and we're grateful for you listening to us today.
Thank you so much, Robin. So what you're now looking at on the screen are some of our suggested responses to this crisis, which is literally what we're talking about right now is really the access to services. But in addition, I want to point out the first recommendation is awareness of the services. So in the state of Connecticut, we have really pivoted to try to create new levels of care. The urgent crisis centers are only, what, 3 years old, I guess, maybe even two. Last year, we opened up the first peer run respite that serves anybody 18 plus, and that is an incredible service up in the New Britain area. The first time Connecticut has had one. I know Rep. Dathan and others worked to bring us that resource. But what there isn't is even like a small amount of dollars for promotion of these resources. So one of the things that happens when a crisis occurs is that people don't even know where to go. And this is something, if you're at our NAMI legislative forums, we're also talking about even in this coming budget year, or the session is a short session focused on the budget. When we create new services, let's designate dollars to actually make them really visible, like the promotions around 988. But other things that you can see on the screen here, can we get a UCC, an urgent crisis center down in this region? Can we address the transportation issues? Our local elected officials we're lucky down here to have teen talk counselors from Kids in Crisis in so many of our schools. But those of us who work in Norwalk are aware that we almost lost the teen talk counselor, Brian McMahon, this year, twice. She is with us today. That's Chitra Suresh. And these aren't particularly expensive programs in the context of a school budget. They're critical to save lives. So I'd like to, again, turn it over to our legislators and elected officials to tell us, what can you do? What would you like to work on, and how can we help you? Rep. Hughes, good morning.
Hey, good morning. Thank you for this presentation. It's super helpful to focus us on the need. I wanted to tie it back to the previous presentation about refocusing some cannabis revenue dollars also to promotion and education. I'm really seeing an intersection of education of the public, of both of the harms and the risks, but also the resources, and maybe there's a way to direct some revenue to better blend, like you were saying, making things, our services more visible. But public education is so important. PSAs, we have almost no budget around that. We have a little bit of budget around enforcement, for the gas station stuff and everything, but there's really no budget. And I know on the NAMI forum, we talked about this. I see Dr. Furstein here. We really talked about, we're not educating, especially young people, about the harms of high toxicity and that kind of thing. And so it seems like we have a gap. So I'm wondering how we could, I agree with Rep. Dathan and everybody else or the presenters, that we need to really address the crisis that we're seeing now with certainly surplus dollars and investment, because we're not getting any help from the feds, especially for our nonprofits.
I'm so glad you mentioned the surplus dollars too, because at our NAMI meeting last week, we saw there's around 300 million of that 500 million set aside this summer that looks like it's about to go back to the surplus. And I wonder if that's even a one-time investment that's an option.
I'll push for it. We will push for it.
Please, thank you. Thank you. Yeah, and the public education, like statewide campaigns, and then the local prevention folks we are educating youth directly. We're educating parents in schools. We're raising awareness locally, but as you saw, it's, $5,000 a year or whatever that we have locally. Senator Marr, and I saw Senator Marr, then Rep. Mara, and then Rep. McCarthy-Vahey.
Hi, good morning. I just wanted to talk about the UCCs because the Children's Behavioral Health Committee has been working significantly focused on the UCCs because of their impact, because they are so important in the state, but also we're seeing really good response. The percentage of children that go to the UCCs and return home within 24 hours is very high. And the fact that they are not sitting in an ED for days because there's no place for them to go. And as you pointed out, Norwalk does not have children's psychiatric services. So that's a significant problem. I've been talking with Stanford Hospital about their growing a children's psychiatric unit, and they are in the process, but it's pretty far out. In addition, what we're looking at with the UCCs is in making sure that the funding stays in the budget, but also that we're looking at ways that insurance can be utilized in the UCCs so that individual insurance will be utilized, as well as, of course, any of the other funding streams that are normally being utilized there. We're very committed to the UCCs. We're looking at data surveys to figure out what's the best way to use them. They started with a 24/7 model. We're taking a look to see whether or not that model really is the most important. We're also looking at community supports. Are there other ways that we can support the UCCs? I've asked for us to get one down in Fairfield County because I think it's essential. I absolutely agree with the comments from both of the people who spoke about the distance up to Hartford and Bridgeport when you live in Stamford. It's just not feasible for parents. So please know that all the issues you've raised are on our screen, and we're all looking at them ourselves. So I just want to mention that. And funding, of course, is something that we are very aware of and the need. And we know that this crisis has not gone away. We're very aware of that as well. So thank you.
Thank you. Rep. Mara?
So thank you for getting us all together. I appreciate being here, and I appreciate the conversation and having us all kind of chatting some of these things out. I wanted to go to a bit of the budget slash, I know you're talking about funding here for UCCs, but someone mentioned the cannabis funds. I think we're going to see, and I'm sorry to say that I wasn't a legislator when the whole cannabis stuff started and went out, because I would have given a heads up that creating a whole FDA in the state of Connecticut is a big financial obligation. And as we have come through this process, I think we're seeing that, because there's more to just cannabis than just growing it and putting it out there and having people that run the companies, right? We want regulations, we want safety, we want to ensure these products are what they say they are. But my point in saying this is we are looking at the federal government changing the schedule of cannabis from Schedule 1, which is an illegal substance, to Schedule 3, which is something that can be prescribed. So I think when as we come through this process, the federal government may very well take over the regulation, because the FDA will now finally be involved with cannabis and with the studying of cannabis. Because when it is a Schedule 1, there's no, sorry to get wonky on this is more my pharmacy background, but I think it's important for everyone to understand there's no studies on the efficacy or the risks. It's Schedule 1, we don't use it. It's like heroin, cocaine, we know we don't use it. But if it's Schedule 3, we look at it as a possible effective substance. And I think that's really important moving forward, because I'm hoping that takes some of the burden of regulation off of the state of Connecticut. And maybe then that will help us be able to maneuver some of those cannabis dollars to be used what they were intended to, which was not necessarily, the intent wasn't that they would have to be used fully for regulation, which we know that is exactly what they need to be used for. But maybe it can go back to education. So I look forward to that moving forward. And as I'm sure you're aware, my caucus always advocates for better funding for nonprofits.
Thank you so much, Rep. Mara. And we are back for those who got here late on the agenda. We're going to be talking about gambling substances next, and then the last section is specifically on the cannabis mental health connection. Rep. McCarthy Vahey, and then we'll move on to our next topic. Hello from the car.
Hi, Margaret, and really wanted to say thank you for pulling this together and for everyone on this call, including our chief electeds, our law enforcement, every other stakeholder that's here alongside you. It's really encouraging. So I'm mainly here to say that I'm really sorry that I'm not going to be able to be here for the rest of the conversation because, as you know, Margaret, we've worked together for well over a decade at this point, and these issues are really important. I want to echo what Senator Marr was saying in terms of the UCCs as public health chair, and I'm fortunate to sit on the Transforming Children's Behavioral Health Committee alongside Senator Marr, and I'm grateful for her leadership there. These issues are absolutely critical, and in the Public Health Committee, we have helped support and spearhead the legislation on the peer support opportunities. We also have talked about, and we were behind making sure that our municipalities are at least reporting in on how those opioid settlement funds are used. And thank you to our municipal partners who are helping each other find effective evidence-based ways to use those funds. But I know I'm not necessarily answering the specific questions here. I think funding is always an issue. And when I think too about the requests we've received from 211 to have more funding go there for the ability to even take the calls that are coming in that you've documented for us, that's another piece. So as you know, I'm going to continue to advocate for more prevention funding. I think we want to have some conversations too about, always effectively partnering with our regional behavioral health action organizations and how we best leverage and utilize those funds. But mainly just a thank you. And thanks to every legislator who has committed to these issues too. So I'll follow up and hopefully can get the recording from you too.
Absolutely. Thank you so much for being here. All right.
And Margaret, just before we move on, I was just going to say, for anybody who doesn't have the chat open, who might be driving, Rep. Dathan asked if the transportation issues are a Medicaid issue or just general, and Dr. Gredinger clarified that they're just general transportation issues.
Thanks, Kevin. Appreciate that. That's Kevin from Westport Youth Services. We're going to move on to gambling, and we have a couple slides on that. I'm hoping we can maybe do that in maybe 5 minutes each to kind of make sure we get through everything with the cannabis at the end, because I think that's going to be a huge conversation. So, Melissa and Rashida, take it away.
Good morning. I'm Melissa McGarry. I'm the Prevention Director for the town of Trumbull. I'm also a member of the Westport Coalition as a parent, as I have 3 young adult children who all attended the Westport Public Schools. So thank you to all of our state legislators and our local leaders and our prevention friends for carving out this time this morning. Many of you are probably aware that with the recent legalization of online gambling, we've seen a real uptick in sports gambling amongst our youth and other kinds of gambling. Even video games now often include an element of like loot boxes and other gambling elements that are priming our kids way before they can legally gamble. The sports betting, our kids are now walking around with casinos in their pockets. So the whole gambling landscape has changed. And as a result, we're all shifting. There's virtually no prevention money coming down to the local level to work on this. There were small grants with often heavy lifts that make it kind of unfeasible for small community prevention coalitions. Some of the local data, national studies say that 4 to 7% of gamblers are estimated to develop a disorder. That number is highest among males and young adults. That data is formed on old gambling models, poker games and maybe casinos and scratch-offs and things. Now it's a whole new landscape. So that number is likely to go up. Local surveys, which you can see on your slide, are illustrating how much time young people are spending on video games and also the number that are gambling. And that gambling looks, many of us are familiar. It's fantasy leagues. It's gambling on sports. If you watch sports, I'm in a household full of sports fans, and you can't watch sports without gambling ads. And many of these ads are offering free bets. So even it's easy for some of our young people to get past some of the age gating. But we've got some, examples of some of the ads on the bottom of the screen. There are also ads that are popular with young people that use their own currency that you can then convert to cash. So Fliff is popular that you can convert, but you can't cash out their currency unless you place a cash bet. So these are all designed to kind of hook our kids and our young adults and our college students in a way that we're all pretty concerned about. And those of us who work in prevention space are stopped almost, anecdotally, I'm stopped all the time by people who are like, "What are you going to do about gambling?" Because they're seeing it in their everyday lives. We have a few policy suggestions. I think those free bets, many of us think those free bets, obviously they're designed to get people to bet. Many people are also not aware that our legal gambling law allows those gambling companies to write off those free bets as marketing expenses. So they're hooking our kids and we're not getting any, that's reducing the amount of revenue we're getting from these companies. So that's something we feel like we could close the free bet. We could either restrict free bets or at least not allow them to be written off as marketing expenses. There is a great deal of advertising targeting our young people. So how can Connecticut restrict that? How can we limit ads during hours when youth are exposed? How can maybe ban ads during live events? I don't know if the ads are coming fast and furious with the football playoffs and with the Super Bowl in a couple of weeks. I saw 3 ads last night within an hour for free bets to bet on the Super Bowl. So, and then the other thing is better data sharing from gambling operators. What are we finding out about who's gambling, who's losing, who's winning? And I'm not sure, we haven't seen any of that data trickling down to the local level. So more transparency would be really helpful. Rashida, do you have anything you want to add from your work with people in Weston?
I mean, I could speak to the mental health aspect of it, where, gambling right now has the highest rate of suicide among youth, higher than mental health issues or other issues. But like you said, the targeted algorithms on social media is a problem. The normalization of gambling starts when we get Roadblocks and Minecraft, where they buy these things and place these bets for these games. And so by the time they are in high school and they're placing bets with Fila and FanDuel, it seems normal because they've been doing it. There's no casino, there's no bookie. As you said, it's in their pockets and the algorithms target them. And the free bets are a problem. There's no other field that offers free first time. You don't get your free first cigarette, your free first drink, your free whatever. But gambling seems to be this exception to the rule. And this is not anti-gambling. This is protecting youth, protecting mental health. It ruins families, it ruins lives, it isolates, it creates suicidal ideation. These bookies outside of these, 3 that we have here, there are online bookies that set up in these places and target them that are not necessarily legitimate programs that then harass families, they harass friends. When you pay from your Venmo, they get access to your Venmo list and then they stalk your friends and families. We've had cases where bookies have reached out to parents' employers to report that their employee's child was gambling, creating job losses for parents. I mean, it's not just the kid, which is horrific, but can affect the entire family. It's not a victimless activity. It destabilizes families.
Wow, Rashida, that's a new one, that reaching out to the parents' employers. My gosh. Well, thank you both. And let's turn this over to our elected officials. What can be done, and can anything be done even this session, particularly about the free bets, which I think have eloquently been shown to be unnecessary at least, and harmful at worst. Senator Perillo, and then Rep. Hughes. Good morning.
Good morning. Thanks. When I look at this list, I mean, I'll just be quite frank. I mean, some of the things that I think are probably going to be extraordinarily difficult, like number four, banning sportsbook ads during live events. I mean, that's a stretch, just being honest. But where you get into the deductibility of free bets, um, advertising targeting, I mean, those things I think are quite honestly in play. Um, the free bets and deductibility is sort of it's a different path from a statutory perspective as we look at tax policy. But obviously we use tax policy all the time to drive social activity. And then the targeting is definitely something, quite honestly, I think probably most of the legislators in the call can get behind. I don't see any obstacle to that, except of course for the lobbyists for the sportsbook companies. But this is a great list. I appreciate it. I think this can drive a lot of discussion and hopefully some action.
Fantastic. Rep Hughes and then Rep O'Day.
Yeah, I agree. Using the tax policy part to drive the, the public safety public safety angle is really good. I'm wondering if we can coordinate with Senator Maroney and regulating AI. So much of this is overlapping with regulating big tech, basically, that has infiltrated, like you say, our algorithms and pushing stuff. And we are so far behind regulating that. And we've just normalized the harm it does, especially to our young people. So I'd like to see some intersection with some other attempts to regulate big tech here, because it's being exploited big time. And, they're not paying for the harm that's happening on our watch. So thanks.
That's a great suggestion, and we would love to follow up with both of you on moving all that forward. Rep O'Day.
Yeah, I agree with the prior speakers. I just emailed putting in a bill to ban the deductibility of that. That's outrageous. So thank you for that. And anybody else wants to put it in, I'll support. Thank you.
Look at that, getting it done in real time. Thank you so much, Rep O'Day. That's fantastic. Yeah.
And Margaret, we had a question in the chat from Dave Walenchik, Norwalk Youth Services, asking if age verification blocks can be mandated for gambling sites.
Age verification blocks?
Yes.
Dave, do you mean like when it pops up and says, are you over whatever age? Because I thought it did that already.
I wasn't aware that gambling sites were already doing that, but if that's not being done, that's certainly something that could be added as a barrier to access.
Thanks. Okay. Yeah. All right. Thank you all. Let's move on to substances. And we're first going to start talking about the substance landscape for a little bit, and including what we're seeing in retail availability, both licit and illicit, and then and enforcement, and the final section will be specifically on cannabis and mental health. I think this is Kirsten Nauman is going to start us off, I believe, from Trumbull.
Good morning. I'm Kirsten Nauman, like Margaret said. I'm the prevention coordinator for the town of Trumbull. And a little bit about the retailer landscape. We know that for substances, the ease of access, it increases normalization for our kids. More importantly, it increases use. And this huge proliferation of retailers, unfortunately, also increases youth access to illicit products. So it's not just what's legally on the market. There's tons of illicit products, which we'll get into on the next slide, that youth have some easy access to. We know that retailer density disproportionately impacts disadvantaged neighborhoods. And while municipal zoning ordinance can have a great impact, statewide density regulations would really be more efficient, because right now each municipality has to make all of their own zoning ordinances. So, there's 169 different towns that are trying to do this one by one. And we know that kids don't just stay in their towns, right? It's very easy for kids to move from one town to another. So if these statewide density regulations were in place, I think that could really make an impact. Margaret, if you want to move forward to the next slide. Yeah. So recently, as part of the cannabis grant, there are 2 cannabis grants were given out in each region. And as part of that, we were required to do some landscape analyses, which we did recently. So we visited local smoke shops, gas stations, convenience stores to see what we were actually seeing. And before I talk about what we saw, I do want to point out that right now the FDA has only approved 4 brands of vapes and 2 brands of pouches. But when we went out there, I can tell you that we saw hundreds easily of products and a wide range of not only vapes and pouches, but we saw things like kratom. We saw illicit THC, including deltas. We saw a lot of foreign products that we really weren't sure what was even in them. We saw 7O, which is a brand and a form of kratom. We saw whippets. We saw psilocybin products. We also saw a lot of drinks that said 18 plus on them. We could tell that most of them had a lot of caffeine in them, but sometimes it was hard to know what else was in them. They would use sort of names that didn't really mean anything to the average consumer in their ingredient list. So that's, really, and these were only the products that we saw, by the way. You go into some of these places and there's hundreds of products that are also like behind the counter or up high, and it's very difficult to see. And we didn't ask if they had other products sort of behind closed doors. So this is just what we saw. And you can see some of the pictures there of some of the products that we did see. We talked about density. When we looked at Norwalk, Norwalk has 1 retailer per about 2,000 population. Monroe has 1 retailer per 875 adults. When we were doing the store checks in Monroe, when I would put into my maps to say, how do I get to the next place, it was telling me to walk because some of them were literally next door, like the next store over. So it's incredible how many are there, and there's just no way that there's that many adults that are using these products. So we know, especially in Monroe, like there's definitely products out there that are targeted to kids. Some retailers are selling nicotine without a license, but there are fewer than before, but we're seeing that. And then 20 out of 40 of the e-cig retail locations in Norwalk were licensed under a different name. So, really concerning. We went there, and the very first stop that we went to, we just kind of felt defeated because there were just so many products out there. When we talk about enforcement, I'm going to turn that over to Lieutenant Kruger and Melissa McGarry to talk about some of the challenges with enforcing these things.
Good morning, guys. Some of the challenges, just give you guys some statistics from Norwalk. Over the last couple of years, we've had 11 different stores sell to minors. 3 of them sold more than 5 times, 1 at 4 times, 2 at 2 times, and 4 at 1 time. When it comes to our vape shops and the illegal selling of marijuana, we've had 11 different stores selling over 1 kilogram of marijuana. One of the stores we did search warrants on at 6 times. 1 we did 5 times. We did 3 times, and 1 2 times. The implementation of a new municipal ordinance that we've done in Norwalk has put a monetary fine on the first violation of $250. The second violation within a year of that is a 6-month suspension of their e-cigarette licensing and license to sell any sort of tobacco products from the city. And the third fine is an indefinite suspension. Our issues that we've run into is the actual of how to take the products off the shelves. I would ask that legislators put forward a direct ability for stores to be closed after the second or third offense of selling illegal marijuana out of the storefront, which obviously all kids can walk into. For an example, we had R&R Vape Shop. It's located at 213 Main Street in Norwalk. They just had a civil penalty of over $1 million put against them by the Department of Consumer Protection after we had a vape shop hearing. They didn't show up to the vape shop hearing, and as of right now, that store is still open. So obviously with the 11 different stores selling marijuana, it's a problem. It's an ongoing problem. We're working on it in the city of Norwalk. The city's doing a great job with the city ordinance, with the new changing of the mayor and the city clerk. We're working hand in hand with them, but it is obviously an uphill battle. So.
Thank you so much, Lieutenant Kruger. Melissa, do you want to just comment on the other things on the screen, or just go to questions?
Yeah,
from
I'll address this really quickly because I see we have some legislators with questions already, as we expected. To Kirsten's point, every town is trying currently to work within their own government systems and planning and zoning to address some of the smoke shop issues. So we have some examples from the region. Norwalk, as Lieutenant Kruger said, has really been kind of at the forefront on the enforcement side of things. So they are using some new tools. There's a new ordinance in Norwalk, which you can see has increased the penalties. In Trumbull, we have a Tobacco 21 ordinance that we passed before the state passed their Tobacco 21 ordinance, which actually allows our health department to license and enforce smoke shops and tobacco retailers. We noticed a distinct difference between Trumbull shops and Monroe shops in terms of compliance to signage requirements. You may not know that the legislature passed a rule a few years ago that all tobacco and nicotine products have to be employee assisted sale. Like you can't just take the product off a shelf. You have to have it's supposed to be locked behind either cabinets or shelves or displays. We saw in Monroe quite a few that the products were just sitting on the shelf or on the counter and they were self-serve. So we noticed a real distinction between Trumbull and Monroe there. And then in Stamford, you saw their map a couple of slides ago. They've done
that was the Norwalk map, sorry.
Oh, sorry. Stamford also has a map that shows that where their smoke shops had been concentrated. They have passed some planning and zoning rules that smoke shops go through the same approval process as cannabis retailers. So they've seen, since they've increased the speed bumps to application and require local application, that they've seen no new smoke shop applications. So, we're 169 fiefdoms trying to cobble together policies, which is why on the next slide we'll talk about some suggested statewide opportunities. So I see we've got some legislator hands up already, Margaret. So do you want to quickly just run through the legislators can actually see we've got 7 suggestions. We've got a lot. So I'll run through these and then maybe that will inform some of your questions. Density. We showed you some of the density in some of our communities. There are no statewide rules on minimum distance between retailers. We had 5 within walking distance in Monroe, minimum distance from youth sensitive or schools, like we do with alcohol, and no statewide, is there an opportunity to put a statewide cap on this? We don't need any more smoke shops. It's worth mentioning that 3 smoke shops in Monroe were cited in October for selling illegal THC in significant quantities. So to Kirsten's point, for these businesses to stay profitable, they have to be selling illicit materials. We wondered whether there's an opportunity to align our density rules with alcohol. You can't have unlimited number of liquor stores in a community. The density cap at the state level is 1 per 2,500 residents. So Monroe, if you take out the adults, it's 1 per 1,150. So you see a significant difference there. With alcohol, there's a whole process with DCP where communities, they put up those billboards. Someone has applied for an alcohol license at this address. Here's who's applied. Could we do that with smoke shops as well and give the communities a chance to comment? Nicotine pouches, which have become increasingly popular because they're discreet and easy to hide. They're targeting our especially young males and male athletes. So get the nicotine hit without the lung involvement of a vape. Those are not taxed at the same level that other nicotine and tobacco products are. So they are really inexpensive. We're talking about like $3 per container. So they're, we know young people are price sensitive. So is there an opportunity, if we're talking about generating new revenue, to increase the taxes on nicotine pouches? We have continued to advocate for banning flavored vapes, as the states around us have done. When you go into these smoke shops, the range of flavors is infinite and clearly appealing to young people. The UK has banned disposable vapes. We're having a lot of conversation about the environmental impacts of disposable vapes. We all see it. It's plastic and batteries and, and substance and chemicals. And so what is that doing? It's creating an environmental impact. We are very grateful for the legislature expanding our enforcement tools. There have been some really great advancements. Not all municipalities have figured out how to use those the way Norwalk has. Not all municipalities know about them. So things like you can now lock the doors on bad actors. Landlords can be penalized once they're aware that their tenant is selling illegal THC. It makes them liable. So that's a great tool. Norwalk Police Chief has talked about using nuisance abatement laws, which can be used against these, and using these greater municipal fines. But you do this great work, and now we have to make sure that all the communities know that they have those tools available to them. So greater pushing, greater promotion of that. And then Kratom, as of the legislature gave DCP the power to classify kratom and its derivatives like 7-OH as a controlled substance as of October 15th, I believe. We've listed the act there. As of today, they have not taken that step. So kratom is still, we saw quite a bit of kratom in gas stations. And kratom, if you've seen, is called like gas station. Some of these derivatives are being described as gas station heroin, highly addictive. And our friends in New Canaan are having, the New Canaan's parents group are having a presentation this week on the addictive nature of kratom. So there are lots of opportunities here. We are making, we have taken a lot of steps. We appreciate the Attorney General's office taking such leadership, but there's so much more work to be done. And I encourage you, if you haven't, go into a gas station, go into a smoke shop and see what's being sold in our communities.
Thank you so much, Melissa. Senator Perillo, and then Rep. Mara, please.
Thanks. So I appreciate this information. This is kind of a pet peeve of mine and a priority. Certainly not just because I represent Monroe. Just some questions, and Lieutenant Kruger, maybe you can give me some information on this. So when you're seeing violations, and you talked about this a little bit, but what are the types of violations you're seeing? And I know we're talking about illicit sales and other things, but in terms of priority, what are you seeing, Lieutenant, as the things that seem to, that you see more often and that seem to be the most egregious?
Most often, I mean, the marijuana that's inside the vape shops, it's everything from just normal marijuana that you'd see coming off of a plant. And then there's all sorts of the THC vapes. They keep them in trap compartments that are controlled by magnets. So you need to find the traps that are either in the floor, in the wall, bookcases. So they know they're in safes. We've had to have the fire department come over and break into safes for us. So the sheer volume of marijuana that they have inside, we've seen up to 10 pounds inside of the stores. So I would say that's the most egregious. They're selling pretty consistently. They're back open mostly the next days. We are working on notifying landowners. We are going through some nuisance abatement processes with the court. Obviously, those take a little longer. But to answer your question, I'd say it's the sheer volume of marijuana that goes through these vape shops and the ease of accessibility.
Thanks. So then a follow-up to that, and you may or may not have the answer. One of the things that I'm concerned about, and professionally, I work at Silver Hill Hospital with Dr. Gerber, so this is something it's a priority. In the product you're seeing sold at these smoke shops, is it in compliance with the state's limitations on THC concentration, or are you seeing that it's outside those parameters?
So anything that's sold with the state, if it's over 0.03, it has to have a dispensary license. I would say that most of the stuff, no, it's not. It comes from overseas for the vapes. So the control of those, I don't know what's inside those. As for the marijuana, the loose flower is what we call it, that everybody would typically look at, the green leafy substance, could come from anywhere. Whether it's grown in somebody's basement or if it's grown overseas and shipped in, that's debatable. So I would say obviously not in compliance with dispensaries since they don't have a dispensary license, and there's no control over where the actual product's coming from. So therefore, there's no regulation of what's actually being ingested by whoever buys that, which is
right. And that's my bigger question is where is it coming from? And again, not just the THC levels, but quite honestly, the safety beyond that.
Correct.
I know another number of other states are seeing that as an issue. And then just less of a question, more of a comment. I see, towns like Norwalk and Trumbull taking pretty strong steps from a local ordinance zoning perspective, and then other towns perhaps not. Has CCM issued any sort of best practices, model ordinances, model zoning that can be used by multiple towns and taking what towns are doing well and bringing it to towns that really aren't? Have we seen any of that yet? And can we as legislators be helpful in that process? Because it sounds like they ought to be at the table here. I guess I'll take the silence as no.
The Connecticut Council of Municipalities, is that
Yes.
what you're referring to? Yeah.
Okay, so that answers my question. Thank you.
All right, thanks. Rep Mara, and then we're going to move on to make sure we use the last 20 minutes to cover the THC and mental health part.
Thank you so much. I have been involved with this conversation ever since I started my position as a state rep. And thank you to Lieutenant Kruger for your descriptions of what's going on in Norwalk. I sat down with Chief Walsh a few years ago, and that was when we came up with the CUTPA violations, and that's what you're talking about in point 6 that you've got on your list. That the way we found to get to get around some of these issues with closing down is to say that you have an unfair trade practice act, and that allows the Attorney General to and DCP to crack down. Unfortunately, it doesn't help the local law enforcement to just initiate that process themselves. And I'd be happy to move forward. That was the easiest thing that we could get through. And I know that Norwalk particularly is using that. So any education to the other municipalities would be appreciated. Kratom, we were able to pass that. Public Act 25101. And you're right. It's, this is actually, I have to say, pretty amazing that we were able to put Kratom in before it started blowing up across the board. I mean, other states are talking about this now, but it's all of Kratom, including the 7-hydroxymicrogyne, which is really good, except it had to go through the process. So just an update to you, is going through the regs process, and the meeting for that is February 24th.
Oh.
So once it goes through that regs process, if it's approved by that committee, then you're home free on that, and it'll be added to a Schedule 1.
Thank you for clarifying that, Rep Mara. And then the new challenge will then be educating all of the retailers who have massive amounts of Kratom and 7-OH on their shelves, because I did actually ask one of them at one of the smoke shops I was visiting. I said, I've heard that Kratom is becoming illegal. And they just looked at me like a deer in the headlights, right? And that's what we saw when we first passed RERACA. And then in Westport, like a couple weeks later, found that there were, smoke shops selling THC to minors, but thinking, oh, THC is now legal. And so that's going to be an educational challenge for us.
Yeah, because they were trying to originally just say, oh, maybe we'll just not give it to people under 18. But we see the expansion of Kratom as just a hot mess, really. So we think it just needs to, and psilocybin also is illegal. So Kratom, psilocybin, that should not be. Psilocybin shouldn't be on the list anyway. It's already illegal. It's a criminal substance. So, okay. Thank you.
Thank you for that. So moving on to the biggest topic and final topic, we've got about 17 minutes left. So I'm going to ask every speaker to cover their content really quickly, but we want to talk about the impact of our cannabis laws on mental health, particularly among youth. THC, especially the high potency stuff, can affect brain development, youth mental health. Our hospitals are seeing increases in visits from cannabis. Just some data on the screen there. You can see Norwalk residents, youth and young adults visiting hospitals last year, visiting emergency departments for cannabis related reasons. And The data is quite clear at this point. We've only got two pictures on the screen, but it's quite clear that cannabis use, especially in young adults, especially high potency, is very strongly associated with psychosis, and often that becomes permanent, and severe and persistent mental illness such as schizophrenia. I don't know if Amy made it here today. Is Amy Wadsworth with us? Amy is a mom who was potentially going to be able to just say a little bit about what happened with her own son, because he went through and is still going through this struggle with cannabis affecting his mental health. Not seeing her here, I'm going to ask first Dr. Feuerstein and then Dr. Gerber from Silver Hill Hospital to speak to this a little bit.
Margaret, thank you so much. I'm Dr. Joe Feuerstein. I'm the chairman of the board of the County Medical Association, but more relevantly, I teach residents twice a week in the emergency room, which is where I am headed right now. So I'm in my car. I'm going to give you a view from the trenches. So Journal of America, it's all science. Journal of the American Medical Association, 2024, there were 2.7 million visits to the ER in the year for hyperemesis, which is where you have from cannabis, which is where you're taking cannabis and it makes you vomit and you can't stop vomiting and you are so dehydrated that in you come. And I know that this is a budgetary thing, so let me just point to where the budget is in this. So many of the people who we're seeing are on state insurance. The average cost of an ER visit, according to normal research, is about $6,000 every time they come in, but that actually isn't correct. As a person who works in the ER, the actual budget is the actual effect is much higher. And why? So you look at the Journal of Addiction from 2019, and what they did is they looked at radiologists and ER doctors, and they said, how much does it really cost when a person comes in with vomiting and vomiting and vomiting? Because the thing is that we don't know, we can't conclusively say, oh, this isn't an obstruction of the intestine. This isn't a twisted bowel. So we're going to have to do imaging, and that's a $10,000 imaging study right there. So actually, it's $72,000. So every time one of your state recipients of insurance comes to the ER, it's not $6,000, it's much more than that. And in the country, it's 2.7 million people. So, and the other thing I just want to say very briefly is that there is a direct association between potency and hyperemesis. So you didn't see this in the 1960s when it was 4%. People weren't coming to the ER vomiting everywhere, but now they are. Why? Because the potency caps are, in my opinion, absurd, and you're just going to spend a lot of money, whatever you make from your cannabis revenue, you're going to spend it in the ERs, which might be good for hospitals, but it's not good for your budget because you're going to spend billions eventually on this. Thank you.
Amazing. Dr. Feuerstein always has terrific data at his hand and a dynamic, passionate presentation. And Dr. Gerber, same to you. I know you're going to share from Silver Hill Hospital what you're seeing.
Thank you so much, Margaret, and thank you everybody for being here. I've spoken to many of you about this, and I'm proud to work with my team at Silver Hill Hospital on this. The sad and short truth is we are seeing an absolute epidemic among young people, adolescents and young adults, in terms of high THC cannabis leading to psychosis. And I think all of you are aware that psychosis is a psychiatric emergency. That is something in which people's understanding of reality is suspended and can potentially lead to lifelong struggles with a psychotic disorder, of which schizophrenia is the most common and devastating type. This is a true psychiatric emergency. Not only does it impair the functioning of the individual, but it basically impacts their entire lives. School, jobs, the ability to have relationships, and ultimately safety as well, because psychotic individuals can put themselves and others at risk. So this is a devastating consequence that is far more common than I think most people realize. People think of cannabis back what it was 30, 40 years ago, which was so much lower concentration THC that psychosis, if it happened at all, was brief and not lasting. With current cannabis, we are seeing this far more commonly. But look, people ask me for data about this all the time, and I want to share 3 or 4 important statistics with you. First of all, one of the challenges is it takes time to see this in populations. So to ask the question, how is Connecticut seeing the rise in psychosis? We don't have that data yet. And it's a tragedy, A, that we don't have the money and resources going into detecting that, but B, that we're going to have to wait to see the devastating consequence before we have that data. However, we are not the first state or country to legalize marijuana and to see these consequences. So let me start with the one you're most familiar with, Colorado. So following the legalization and opening of retail outlets in Colorado, the monthly average of psychosis hospitalizations, this is 10 to 29-year-olds, rose 50%. That is, it rose from about 22 per 100,000 to 32 per 100,000. That alone tells you right there. That's Dr. Feuerstein and his colleagues. Psychosis visits specifically for cannabis induced, this is back to this question of does legalization lead to higher utilization, rose more than 4 times. That is from 2 to 8.5 per 100,000. So to me, that's all the data you need right there in Colorado, which was a state that legalized cannabis long before us. But now let's move to Canada, because after legalization of cannabis, there was a tripling of the cases of schizophrenia that were attributable to cannabis. It went from 3.7% up to more than 10%. And among young males in particular, that is 19 to 24, that's the highest risk group. This is now in Ontario, in Canada. Almost 19% of the cases of schizophrenia are now attributable to cannabis. So if you ask the question, well, maybe they were going to develop schizophrenia anyway, the answer is no. As many as 19% of them in that age group are attributable to cannabis. Now, Denmark, going a little further away, but they saw a 3 to 4-fold increase in schizophrenia attributable to cannabis over 2 decades. They legalized much earlier. It rose from 2% in 95 to up to 8% in 2010. So if you think about it, that means that anywhere from 15 to 30% of schizophrenia cases in cannabis could be avoided if cannabis was not part of that. And the last thing I'll mention is just our experience here in New Canaan, obviously a much smaller scale, but we are now seeing 80% of the individuals coming in with psychotic disorders in that young age range have heavy cannabis use. I'm not saying all of them wouldn't have had psychosis otherwise, but if you look at the data from other places, as many as a third of them could have been avoided. That's devastating. And the fact that we're not doing more to stop that really, to me, is a call to action. And I'm so glad that you're all here thinking about this together. I know we're on the same side of this, but now the practical question is, how do we turn that data into action? Thank you, Margaret, for having me, and thanks everybody for being here.
Amazing, Dr. Gerber. We have 2 final slides on this. So I'm going to turn it over to my colleague Francesca to walk us through the guardrails we do have in place and what our asks are specifically now, and then we will open up to final questions.
And Margaret, Amy Wadsworth rejoined. She's just popped into the chat and said she's available to speak as well.
Okay, and so Amy, we'll get through these slides and then open it up for our legislators, and hopefully you can have a chance to share a little bit then. Thanks, Kevin. Francesca.
Yes, hi, good morning. Thank you, Margaret. As Margaret mentioned, my name is Francesca Guerrier. I'm the project manager in the region for the Youth Cannabis Prevention Project. And so we thank you all for sticking through. I know we are very short on time, but I do want to speak towards just maintaining the Connecticut's THC potency caps and just making sure that we keep the restricted labeling requirements as just pretty, essential tools for protecting our youth's mental health, as was mentioned earlier. And just the overall health of the public. So I'm not going to go too deep into a lot of what was said, but we know that we're at a time where anxiety, depression, emotional distress amongst our young people are at historic highs. So although it was just mentioned, we don't have a lot of statistics, there are research and information that consistently shows that, adolescents are vulnerable to the effects of THC because their brains are still developing. We have had a lot of folks on this call and conversations that are going to continue to happen. I think they're going to speak to it on one of the next slides. We're having many community conversations across the regions where we're highlighting and making sure folks are aware that high potency products are associated with increased anxiety attacks, higher likelihood of psychotic episodes or psychosis, worsening depression and mood disorder, and just a greater risk overall of developing cannabis disorders. And so, these risks for these put youth at risk for just all of these different mental health crises. And so we know that the potency caps are probably one of the fewer tools that policymakers that you all here on this call have to reduce the exposure without, completely eliminating access for the adults. But, we're talking really here and focusing on the youth, the neuroscience, all the work in prevention. So sometimes they don't access cannabis intentionally. Sometimes they're exposed accidentally through edibles. We saw in some of the last slides, some of the things that are shown on the shelves, how they mimic and mirror a lot of the candies and gummies and sweets or whatever the kids things that the kids are eating. We've seen a lot of these things in recent news. So it's very important to have clear labeling. Making sure that the THC standard serving sizes are very clear and marketed. Restriction on these packages, as we are seeing, these will help kind of reduce the likelihood that teens will because we're doing a lot of marketing, we're doing a lot of promoting, and we're trying to raise awareness for them to understand how strong these products really are and how the parents who are and caregivers are unknowingly storing these dangerous products. So we're trying to push and promote these messaging and information, but when the products are clearly labeled and they're less potent, the risk of these reactions and impairments and emergency room visits, as we saw, those numbers will go down. So we saw the results of the landscape analysis. We're hearing all the different folks and the folks, the parents, the educators, the mental health providers, all of us who have our boots on the ground. We're really working hard to support youth's mental well-being, and our prevention messaging becomes really hard and becomes challenging when the products are potent. So we're asking you all to really maintain your guardrails. When we see that potency caps are being raised, we're really asking you to make sure that, we stick to our guns and kind of our guardrails. The marketing, minimize it, help minimize the risk. The THC content can be very confusing. We, on the prevention side, in this realm, we're saying and we're promoting one thing, but what's being put on the shelves then in the retail markets, I think Kristen mentioned earlier, it's vastly different. And so then it becomes confusing. It's very inconsistent. So that's why we really ask you all to maintain what, and not raise the potency cap and not, push for all these changes that are very harmful to our youth. So the strong regulations, clear messaging that these products are harmful to the developing brains continues to be a policy priority. So we truly thank you for your leadership and prioritizing all of the well-being of Connecticut's, our children and our family. We do have 4 ask and
Yeah, Francesca, I've got that up on the screen. We have minutes left, so thank you for sharing that. I just want to add, we have been hearing that there's a push from the industry to lift our harm reduction guardrails, right? Last year, the potency caps were raised. There has been there's going to be a push that may be coming at you this session or next to say, get rid of them, get rid of all the labeling restrictions, and we're talking about on the legal products here, right? So we ask you to stand firm. And Senator Perillo, what can you tell us?
No. I know you guys want to wrap up. Just a message to legislators. We are going to hear every excuse in the world from the industry about why we shouldn't lower potency levels. Not the least of which is going to be that people will turn to the black market for consumption. I get it, but that cannot be a barrier to this. That cannot be the reason why we don't do this. It's just too important. And I think working with law enforcement, I've got a call with the police chiefs later this week. We can find a way around that hurdle if indeed it even is one. And I'm more than happy to work with any of you on this.
Such a good message. Thank you for that. Any other legislators? I will also say, I think those of us who are the advocates in the room will be happy to stay on the call later than 10 if anyone wants to hang out, but we also want to respect your time. Any other comments from any of our elected officials?
So Rep Hughes asked in the chat about the prevention community's thoughts on raising the age of adult use cannabis to 25 to align with brain science and the risks to psychosis.
Wouldn't it be great if we did things based on brain science, Rep Hughes? Yeah. Rep O'Day?
Yeah, so I had put in as part of an amendment to the recreational marijuana bill a age of 25, and unfortunately it failed on party lines. But just for other legislators, I've already put in a request to submit 1 through 7 of the requests. And I also will put in, Rep Hughes, if you want to join me in a bipartisan bill to raise the recreational age to 25. I'd love to have your name on it.
Amazing.
You got it.
You guys, that's fantastic. Thank you so, so much. And let us know the bill number when it comes out. We will get people there to testify. If any other elected officials or others have, I guess, first, if other elected officials have questions or comments for us. I know Amy Wadsworth was not able to be here at the moment that we were ready to have her share a little bit about her son's journey. She can stay on, or some of us can stay on, but please take a look at the screen. We are having New Canaan Parent Support Group mentioned earlier is having a Kratom webinar this week. And through our DEMIS-funded Mid-Fairfield Youth Cannabis Prevention Project, we are having the speaker series. They're all being recorded. And we can send you links to all of these, but please join us. The next upcoming talk is February 25th, and it's Dr. Swift from Silver Hill Hospital. Rep O'Day, your hand is still up? Maybe
nope,
that was
excellent. Sorry.
Okay.
Margaret, I just wanted to say, this is Ellen from Kids in Crisis. I just wanted to thank you for this incredible presentation, but I also wanted to just mention that tomorrow night we are having a webinar, Greenwich Together, and Darien and Stanford are collaborating, bringing Laura Stack to talk about the dangerous truths about today's marijuana. So I can send you that link if you want to send it out to this group as well.
Absolutely. I know several of us have heard her before. She's terrific. She really focuses on the mental health marijuana connection from a parent's perspective and with all the scientific evidence.
Hey, Margaret.
Yeah, is that Sal?
Sal,
Sal, go ahead.
You can invite legislators or the first selectman or any police department if they want to join us at any of our meetings. You can send dates of our Prevention Coalition meetings in Westport or any ones across the state, so they can come when they're free, and we would love to have them join anytime.
Great point, Sal. Yeah, everybody, if you registered for this or provided your email somewhere after this, you will get a link to the recording. You'll get a link, you will get the slideshow and a document that does include all the local Prevention Coalition contact info, as well as all kinds of research and articles and links to state websites and so forth. Dr. Oshman, I just saw that you had your hand up. Hi, Robin.
I just wanted to add that we don't even know all of the side effects that are going to be coming down the line due to the cannabis smoking. Dermatologists are now seeing, I'm a dermatologist, and in our literature, we're now seeing that there's something called cannabis arteritis that's seen in young male smokers. And what they have is spasm of their small blood vessels. So it results in small blood clots in tiny vessels, causing ulcerations on the fingertips, on the ears, and on the toes, and also claudication, which is pain on walking. So, this is just another thing that's coming out with these increased concentrations of THC in products. So we should all be aware that there may be new things that we see and try to prevent this, especially with the caps. I think that's so important to cap the concentrations. It's another reason to cap things because we know these are drugs, and the higher the drug, the more side effects you see, even just with regular drugs that we take from our physicians. So it's something to keep in mind.
Thank you. That's a new one to me. Auto right. Can you drop the spelling of that in the chat?
Sure.
Thank you.
Arteritis just means inflammation of the blood vessels.
Okay.
So it's cannabis arteritis. It's called. I'll send it to you.
Thank you. All right. Well, it looks like we've still got 62 folks here. Open to any final comments or questions, but if not, we will, give you your back to start off your Monday. And we're really grateful to all of you for being here, especially to those who, and like Repo Day, literally submitting legislation in real time during the call. We will definitely be following up with our elected officials. We thank you all. Reach out to us during the session or during, RTM or Common Council meetings when you are looking for ammunition, looking for questions and answers, because you can see there are a lot of us involved in this work coming from different stakeholder backgrounds, and we're all eager to collaborate. So thank you all so much. Have a wonderful day.
Thank you. Thank you, Margaret, and thank you, everyone.
Thank you so much.
Thanks a lot.
Take care, everybody.